Home birth used to be the only option for giving birth until the 1700s. Friends, family, and midwives would help with the birthing process. But in the late 1700s, doctors started to get involved to make birth safer. Then in the early 1900s, hospital births became more popular because they offered less painful birth with anesthesia. By 1935, only 15% of births were done at home with a midwife. Nowadays, just over 1.5% of births in the U.S. are done out of hospitals, either at home or at a birthing center. Some reasons why you might consider a home birth are: giving birth in a familiar and comfortable environment, a desire to avoid medical interventions, staying faithful to your religious and cultural practices, having your family and friends present at the birth, having more control over the birth, wanting to save money, lacking transportation. When considering a home birth, it's important to take a few steps into account. First, find a trained healthcare provider, such as a certified nurse midwife or a certified midwife, to assist with the birth. You may also want to consider having a doula present to provide support during pregnancy, labor, and postpartum. In some areas, OB/GYN doctors may be available to assist with home births, but it's important to ensure that there is a trained person present whose sole responsibility is the newborn. It's also essential to create a home birth plan. This involves thinking about the logistics of the birth, including the necessary supplies and equipment, who should be present during labor and delivery, pain management, birthing positions, breastfeeding preferences, and plans for cord clamping and placenta removal. It's important to communicate your birth plan clearly with your chosen healthcare provider and to have a backup plan in case of complications that may necessitate a transfer to a hospital. Finally, be prepared to go to the hospital if necessary. It's important to discuss with your healthcare provider the signs that may indicate the need to transfer to a hospital, have a hospital bag ready, arrange transportation, and make a list of emergency contacts. Additionally, it's important to plan a home birth within close proximity to a hospital that offers 24/7 maternity care. If complications arise during the birth, such as prolonged labor, medical complications, or signs of distress in the baby, it may be necessary to transfer to the hospital for further medical attention. The potential risks of having a home birth include a higher risk of infant mortality, with 1 to 2 out of 1,000 home births resulting in death, which is at least twice as high as hospital births. An increased risk of neurological damage and seizures during birth, with 0.4 to 0.6 out of 1,000 home births experiencing neurologic dysfunction, which is 3 times as high as hospital births. To reduce these risks, it's important to work with a properly trained and licensed midwife. Some midwives are nurse midwives, which means they are registered nurses with advanced degrees in midwifery. In some states, nurse midwives can only work under a doctor's supervision, while in others, licensed or certified midwives, who are not registered nurses but have extensive midwife training, are allowed to assist with at-home births. Additionally, many nurse midwives and some licensed midwives also practice in doctors' offices or other medical settings. A doula is a person who offers physical and emotional support to the mother throughout the birthing process. They can help with things like suggesting labor positions, guiding breathing exercises, and supporting everyone involved in the birth. They are also available before and after labor to answer questions and provide support. There are also postpartum doulas who help with breastfeeding, cooking, and cleaning after the birth. A home birth for a low-risk pregnancy can be more affordable than a planned hospital birth, with some home birth packages offering a global fee that includes prenatal, labor and delivery, and postpartum care. According to a nationwide survey, the average cost of a home birth in the U.S. is $4,650, but this can vary depending on the state, region, and the level of training of your midwife. It's important to note that health insurance companies typically do not cover home birth costs, so it's recommended to check with your provider to see if they can cover certain expenses like childbirth classes, midwife or doula fees, and other baby-related costs. Additionally, keep in mind that there may be additional expenses for equipment, transportation, birthing, and baby items that may not be covered in your global fee. So, what do you need for a home birth? First, you'll need supplies to keep the area clean and tidy. This includes towels, washcloths, sheets, and sanitary pads. You'll also need items like ice packs, heating pads, and garbage bags. It's important to have a birth kit ready, which should include a copy of your birth plan with emergency contact information, as well as over-the-counter pain medications that are safe for pregnant or postpartum use. You'll also need items for postpartum care, such as a sitz bath or hemorrhoid cream. And don't forget access to warm water for compress or water births. For the baby, you'll need newborn-sized clothes, diapers, a digital thermometer, and an infant car seat. Lastly, make sure to have meals prepared for yourself, your birthing partner, and the midwife or doula who will be helping with the birth. After giving birth, it is recommended to have at least one trained person to care for the newborn's needs and health. It's important to speak to your close family and friends for support and help with newborn and household chores in addition to the trained medical person. Make sure to talk to your midwife about the postpartum care they offer, as both you and your baby's health will need to be closely monitored for any complications. Your midwife might also provide coaching for breastfeeding and offer support, advice, information, and tips on how to care for a newborn. If you're considering a home birth, here are some things to consider. Your pregnancy is low risk. You're generally in good health. You're only pregnant with one baby. Your baby is in the proper head-first birthing position. You have never had a C-section. You're not at risk for early labor or premature birth. You don't have preeclampsia or high blood pressure. Your partner supports your decision. You understand that your plan may need to change, as 40% of first-time parents end up going to the hospital during a home birth. Remember to discuss your decision with your obstetrician to ensure the safest option for you and your baby.